I have two great guests watching along with us now. I want to bring them in for some analysis. Forensic psychiatrist and body language expert and author Dr. Carole Lieberman is with us. And I want to get your assessments of this, just this case as a whole. I know we're early on, but oh my gosh, how tragic. Dr. Carole, let me begin with you. As a psychiatrist, you're watching this doctor on the stand right now. Where we left off, he's talking about the ketamine administration. Who do you think was wrong or right in all this, please?
Well, the hospital and its minions, particularly the social workers and the doctor who was called in who to look at, to gather evidence for abuse and so on. Let me help your audience by talking about some of these psychiatric diagnoses that were sort of bandied about. First of all, conversion disorder. A conversion disorder is when someone has psychological problems. It could be anxiety, it could be unconscious kinds of things, and that manifest in physical symptoms, as opposed to factitious disorder, which is when the person is just clearly making it up. Also, Munchausen's by proxy. What that is when a parent, typically a mother, who wants attention and sympathy for herself, uses her child and takes the child to all kinds of doctors, to get all kinds of treatment, to get this attention and sympathy. And sometimes the parent will create the diagnosis, create whatever the problems are that they're taking the child to doctors for. So that's what they were thinking that this mother was doing. But really, this is a case. Unfortunately, this is a very important case, and I saw the Netflix documentary "Take Care of Maya." This case will bring attention. It's not only, of course, I think that the family deserves a lot of money, but what's also important is that it'll bring attention to DCFS. And so many parents in America have been destroyed. This is, of course, a particularly tragic case. But in other ways, so many families have been destroyed by misguided DCFS workers.
Dr. Carole, thank you for that. Dr. Carole, to this doctor who's testifying as a plaintiff's witness, it seemed very evident to him what Maya was suffering from. Could that be something tricky, though, that other doctors could have missed? Yes, actually, complex regional pain syndrome is a very confusing diagnosis, or can be, because it's a neurological diagnosis. So it's not, the signs and the symptoms that you see aren't necessarily like, for example, if there are lesions and so on her skin. It's not a skin disease. It's all coming from the neurology. However, by the time she went into St. Johns Hopkins, she had already been diagnosed and she had already been treated. I mean, there shouldn't have been, and her doctor, at least Dr. Kirkpatrick, if not Dr. Wastner, had already spoken to Johns Hopkins, so there shouldn't have been a question at Johns Hopkins of what her diagnosis was. Right. Appreciate it, Dr. Carole. Much thanks to you, and much thanks to you, Dr. Carole Lieberman, for coming on the show.